Welcome to this video, which is the third in a series providing analysis of the spread of COVID-19 throughout the world. On a daily basis, the World Health Organization publishes on their website the COVID-19 data for member states. This is then published as a situation report. This data separates member states into regions. For example, Southeast Asian region member states are Thailand, Indonesia, India, Sri Lanka, Maldives, Bangladesh, Bhutan and Nepal. The situation report gives member states and regional cumulative numbers of the COVID-19 cases and deaths linked to COVID-19. The first situation report from COVID-19 was published on the 21st of January 2020, and a subsequent situation report has been published daily since the initial report. This analysis has drawn data from multiple sources which are credited at the end of the presentation. In China, there are currently 82,057 confirmed cases across China, which is an increase of 641 cases of COVID-19 since last week. There are 3,304 deaths attributed to COVID-19, an increase of 43 over last week's total. China this week relaxed the quarantine that had been in place for Wuhan, where the first cases emerged, and life appears to be returning to normality. China is maintaining that the cases this week are individuals who have returned to the country from abroad and have put further travel restrictions in place to prevent foreign nationals from entering China. All national governments, health experts and scientists will be monitoring the information coming out of China over the next several weeks for signs of a secondary wave being established. In the Western Pacific region, currently there are 19,232 confirmed cases across the region, an increase of 6,609, with 291 deaths attributed to COVID-19, an increase of 108 from last week. The main surge this week has been in Australia, with almost 3,000 cases over last week's total. The Australian states of New South Wales, Victoria and Queensland have the largest increase in cases, followed by South Australia and Western Australia. There have been several instances of own goals by local state governments in the management of cruise liners, resulting in the seeding of virus in population centres and individuals not heeding the state and federal government's advice on social and physical distancing. The regional data and graphs suggest that in some countries there is the emergence of community transfer. This is especially true on the east coast of Australia. It is highly likely that the Australian health system may be severely impacted, especially on the east coast, within the next 4 weeks, unless the population follows social and physical distancing guidelines. In Europe currently, there are 321,304 confirmed cases across the region, an increase of 192,759 from last week. There are 18,737 deaths attributed to COVID-19, an increase of 12,621 over last week. At the moment, Europe is still the epicenter of COVID-19 outbreak, but this will shift to the United States within the next 7 days. The next section will focus on the major European countries that make up the bulk of the numbers above. In Europe, Italy, Spain, France, Germany and the UK make up the majority of the cases of COVID-19. But several countries are not that far behind: Netherlands, Switzerland. By far, Italy and Spain have been impacted by the most, and their respective health systems have been overwhelmed. Shortages of critical beds, equipment, and unfortunately, frontline healthcare providers become infected and perished. All countries have implemented steps to delay the spread within their communities, and the emphasis in most countries have been population self-isolation and/or enforced quarantine for the whole populations except for essential workers. As the weather improves into spring in Europe, there's evidence this week that not everyone understands the concept of social and physical distancing. In Southeast Asia, there are currently 6,171 confirmed cases, an increase of 5,190 from last week. There is 119 deaths attributed to COVID-19, an increase of 45 from last week. The Southeast Asian countries have been on a slow burn, but the graph indicates that the Southeast Asian region is now accelerating towards a peak rather than a flattened curve, and a significant concern that health systems across the region will be overwhelmed. There will shortly be an explosion of cases similar to New York, Italy and Spain in the main population centres in India. The Indian government shut down the whole country last week with only 4 hours' notice to the population, displacing large amounts of migrant workers. As these workers gradually work their way back in the Eastern Mediterranean region, currently there are 39,038 confirmed cases across the region, an increase of 16,625 since last week. 2,509 deaths have been attributed to COVID-19, an increase of 1,043. Within the region, Iran has the most numbers, and deaths attributed to COVID-19. But there is evidence of sustained community transfer within the borders of other Eastern Mediterranean countries. Anecdotal evidence from Iran that their health system has all but collapsed, and data provided may not be an accurate picture of the true impact on the ground. The graph indicates that although the region is heading towards an increase in transmission and likelihood that the health systems will be overwhelmed within several weeks. In Americas, currently there is over 125,000 confirmed cases across the region, an increase of over 100,000 since last week, with over 2,000 deaths attributed to COVID-19, an increase of over 1,500 since last week. Most of the growth in the region is within the United States, and a separate section will detail the growth of COVID across the United States. Canada has 5,655 cases of COVID-19 and 61 deaths attributed to the virus. The main concern is countries in South America's main population centres who do not have sophisticated, robust healthcare systems and/or critical care infrastructure to manage this outbreak and care for the community. In the United States, currently there are over 124,000 cases of COVID-19. It's a staggering increase of over 93,000 since last week. There is 2,191 deaths have been recorded and attributed to COVID-19, an increase of just under 2,000 from last week. New York City accounts for almost 50% of all COVID-19 cases and fatalities. New York is closely followed by Washington State, California, but there are hotspots in New Orleans, Detroit and Seattle. 2 military hospitals have relocated. In Africa, currently there are 3,656 confirmed cases across the region, an increase of 3,656 from last week. 48 deaths have been attributed to COVID-19, an increase of 36 from last week. The main centres of infection within Africa, until recently, was South Africa and Algeria. However, over the last week, almost every country in Africa has cases of COVID-19, and this has resulted in a sharp increase within the region. The African region does not have the sophisticated health systems seen in other regions and are likely to see a higher than normal mortality rate across all demographics than other well-developed countries. The graph indicates that the region is in the early stages, and without sustained intervention by regional governments, there will be a significant impact across all areas in the African region. Quite simply, take it seriously and act quickly. This is all about delaying the outbreak, to give governments time to adequately resource their health systems, increase the number of critical care beds, mechanical ventilators and personal protective equipment, and ensuring that their health systems are not overwhelmed. Health experts agree on the same measures for containing the outbreak. Test widely, isolate those infected, encourage social and physical distancing. Such measures are being adopted to varying degrees across the world, but a key difference is that many countries didn't act quickly. The European countries and the US lost an opportunity. They had 2 months for what happened in China. Yet there was this perception that China is very far away and nothing's going to happen. Social and physical distancing is considered the best way of containing the outbreak. The difference is down to how quickly governments implement the social and physical distancing. By the time a lot of countries had stepped up control measures, the number of cases were too large. That drastic steps were needed for example, in Italy and Spain. Social distancing is affected by the government's decision to ban gatherings or close schools, but it also depends on people being willing to take part. That's why public messaging and individuals' attitudes matter. If a lockdown ends too early, local transmission could start again. We don't know if the social distancing can be sustained for the kind of period of time that it needs to be sustained. We can't really relax until there's a vaccine, which could take about 18 months. Prolonged lockdowns are damaging the economy, while an epidemic is damaging to public health. There is no good choices. Recent modelling conducted by the University of Sydney shows the criticality of social and physical distancing. With 90% compliance, we achieve a flattened curve. With 80% compliance, the curve is slightly increased, whilst with only 70% compliance, we have a runaway disaster. We all have a responsibility. Comply with local guidance on social and physical distancing. By compliance with local guidance, we will flatten the curve and reduce the amount of infections in the community, protect our frontline healthcare providers, and protect the integrity of our health systems. Failure, community transfer of the virus increases exponentially. Our healthcare system is overwhelmed. Our healthcare system collapses. Our frontline healthcare providers are infected. Difficult decisions are implemented on who to access available resources. The choice is ours to make. If you have been advised to self-isolate or been in close contact with a confirmed case of coronavirus, special restrictions apply. Who needs to isolate? All people, if your government, state or health authority advise or think they may have been in contact with a person diagnosed with coronavirus, are required to self-isolate for between 17 and 14 days, depending on the local rules. You must stay at home or in your hotel. When travelling home or to your hotel to start isolation, use personal transport, such as a car, to minimise exposure to others. If you need to use public transport, e.g. a taxi or ride-hail services, trains, buses or trams, reduce the spread of germs through good hand hygiene and avoiding physical contact. During the 17 to 14 days of isolation, you must stay at home or in your hotel. Don't go to public places, including work, school, childcare, university or public gatherings. Only people who have usually lived with you should be in the same house. Do not see visitors. If you're in a hotel, avoid contact with other guests and staff. If you are well, there's no need to wear a surgical mask at home. Ask others who are not in isolation to get food and necessities for you. If you must leave home, such as to seek medical care, wear a surgical mask. If you don't have a mask, take care not to cough or sneeze on others. Monitor your symptoms when in isolation, including fever, cough, sore throat, tiredness or shortness of breath. Other possible symptoms include chills, body aches, runny nose and muscle pains. What do you do if you do get sick? If you develop symptoms, fever, a cough, sore throat, tiredness or shortness of breath, within 14 days or within 14 days of the last contact with a confirmed case, you should arrange to see a doctor for urgent assessments. You should telephone the health clinic or hospital before you arrive and tell them your travel history so that you've been in contact with a confirmed case of coronavirus. You must remain isolated either in your home, your hotel or a healthcare setting until public health authorities inform you that it's safe for you to return to usual activities. The mental health and well-being of everyone during this coronavirus outbreak is a concern. Maintain a perspective. Almost everyone will be impacted to some extent, but governments and experts around the globe are endeavouring to contain this virus and limit the impact to individuals. The media serves a crucial service in providing communications to the public. However, too much exposure to negative interpretation of news can be harmful. Strike a healthy balance. Avoid it if you find it distressing. It's essential that you maintain a routine. Eat healthy, exercise. If you or your family members are in self-isolation, it's only for a short duration to slow the spread of the virus. You're helping your community and the healthcare system. Maintain links with friends and family via social media. If working at home, remember, take regular breaks. During this period of time, it's really important that individuals avail themselves of reliable information. Reliable information is available from a multitude of different sources, whether or not it's in the region that you live in, your state governments or your federal governments, your healthcare providers, your health departments. Please look up the information, keep yourself informed about what is the accurate information about how to maintain your safety and the safety of your family during this period of time. Finally, maintain your social and physical distancing rules. This will arrest this outbreak. Look after your family, friends and neighbours, and constantly conduct risk assessment about your decisions. I'm always available for further advice and guidance via my email, as you can see, via LinkedIn or via YouTube. Thank you.